Okay, this is the first video for Unit 6 in Respiratory Therapy Science 2, and Unit 6 goes over pulmonary function testing, or PFTs. I would highly recommend that you watch the Zoom recordings that we have, or participate in the Zoom classes that we have during our normally scheduled class periods for this unit, just because it is a little bit harder unit to kind of weed through. I've also put 5 YouTube videos on Brightspace that are really helpful and have good information on pulmonary function testing and all of the different lung volumes and capacities and how they're used. All right, so we'll go ahead and get started on Unit 6. So Unit 6, like I said, is going to talk about pulmonary function testing. Pulmonary function testing is abbreviated PF. And pulmonary function tests are used for quite a few different reasons, but they provide valuable information to assist in the diagnosis and assessment of the different pulmonary diseases. And those will include obstructive diseases and restrictive diseases. They include the study of all respiratory function, and PFTs measure different lung volumes and capacities, different flows, and then we'll also talk about how to determine if they're diffusing gases across their AC membrane properly. So purposes of pulmonary function testing, there's about 5 big purposes to performing PFTs. One is to screen for pulmonary disease, so they're going to look to see if the patient has an obstructive disease or a restrictive disease, and then there's different classifications of diagnoses that fall within each one of those categories. To evaluate surgical risk, so if they're going in for a surgery and there's any question on whether their lung function will be compromised during that surgery, they'll do a PFT. They'll look to assess disease progression, so if they've been diagnosed with a pulmonary disease, they can use PFTs to see if the disease is getting worse or if it's kind of stabilized. To assist in the determination of pulmonary disability. In order for somebody to go on disability for pulmonary reasons, a PFT does have to be done. And to modify the therapeutic approach to patient care. So if, for instance, a patient maybe has emphysema and the medications that they're using aren't really helping, we can try some other medications in the PFT lab and see if those medications would benefit that patient at all. All right, so lung volumes and capacities. The gases in the respiratory system are divided into 4 basic lung volumes and 4 lung capacities. And the difference between the volumes and capacities are a capacity consists of 2 or more lung volumes put together. So we will refer to that as the PFT box. So if you look here, this is the PFT box. You can also look on page 130 in your Practical Math for Respiratory Care. It's that orange workbook that I would highly suggest you read that chapter, which is chapter 11, and you can see the PFT box in there as well. And we're going to talk a little bit how to use that PFT box here in a minute. But if you look at this, these PFT values are normals for a 6-foot-tall male who's 25 years old and weighs approximately 165 pounds. So these aren't normal values for everyone, but these are what we will consider normal values for our pulmonary function box. So IRV stands for inspiratory reserve volume. Normal is 3,100. Tidal volume is VT. Normal is 500 milliliters. ERV, or expiratory reserve volume, is 1,200 milliliters. And RV, residual volume, is 1,200 milliliters. And then if you look, IC, which stands for inspiratory capacity, it consists of our IRV, or our inspiratory reserve volume, plus our tidal volume. So the normal for inspiratory capacity is 3,600 milliliters. FRC is functional residual capacity, and that consists of 2 volumes, our expiratory reserve volume plus our residual volume. And if you add 1,200 plus 1,200, you get 2,400 milliliters. VC is vital capacity. Normal for that is 4,800 milliliters. And if you can see there, that is composed of our inspiratory reserve volume, our tidal volume, and our expiratory reserve volume. And then everything added together is TLC, or total lung capacity. So these are just going to kind of go through the different abbreviations and their meaning. So we'll start with VT, which is tidal volume. You may see it also written as TV, but more commonly you're going to see the first one there, the V with the lowercase t. And that's the volume of air that's inhaled or exhaled from the lungs during quiet breathing. So as you're sitting here just normally breathing, that's your tidal volume. And normal tidal volume is about 500 milliliters plus or minus 100 milliliters depending on the person. But it comes out to about 3 milliliters per pound. And it comprises about 8 to 10% of our total lung capacity. So it's just a very small percentage of our total lung capacity. And tidal volume is the amount of air necessary to maintain the oxygen supplies to your tissues. So again, tidal volume is just that quiet breathing that you do without even thinking about breathing. The different lung volumes, the first one is IRV, which is inspiratory reserve volume. And that's the maximum volume of air that can be inhaled above a normal inspiration. So as you inspire normally, and then you inspire all the way up to maximum, that's your IRV, or your inspiratory reserve volume. Your expiratory reserve volume is the maximum of gas that can be exhaled from the lungs following a normal quiet exhalation. So if you exhale normally and then exhale maximally, that's your ERV. And then residual volume is the volume of air remaining in the lungs after a maximum exhalation. So that's the amount or the volume that will be in your lungs after you've squeezed every little bit of your air out of your lungs. You're still going to have this little amount of air, which is approximately 1,200 milliliters remaining in your lungs. So it's kind of like, if you think of it a little bit like PEEP. PEEP is a pressure, positive end expiratory pressure. So that's the pressure remaining in your lungs at exhalation. Residual volume is the tidal volume, or the volume of air that's in your lungs after a maximum exhalation. So that's air that will always be in there. You can't get that air out of your lungs. And then our lung capacities, IC stands for inspiratory capacity, and that's resting exhalation to maximum inhalation. So if you were to take your tidal volume plus your inspiratory reserve volume, that will be your inspiratory capacity. VC stands for vital capacity, and that's from the top of a maximum inspiration to the bottom of a maximum expiration. And that's the maximum volume of gas that can be exhaled after a maximum inspiration. So that's your expiratory reserve volume plus your tidal volume plus your inspiratory reserve volume. A vital capacity is what therapists try to have the patient do when they're doing a flow volume loop. So if you've ever seen anyone in the PFT lab or heard anyone that's in the PFT lab say, take a deep breath in and now blow all your air out, and then they keep saying, blow, 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 or keep going, keep going, keep going. They're trying to get a vital capacity. And again, a vital capacity is what is the maneuver needed to do a flow volume loop, which we'll talk a little bit more about later in this unit. But again, the vital capacity, you have to take the patient take a deep breath in and then blow all their air out until they can't breathe any or blow anymore, and that will be their vital capacity. FRC is the volume of gas that remains in the lungs after a normal exhalation. So that's going to be your residual volume, that amount that you can never get out of your lungs, plus your expiratory reserve volume. It's also referred to as resting volume, and gas exchange occurs during FRC. So FRC becomes really important, especially when we start talking about neonates and their inability to produce surfactant and things like that. That all factors into their FRC. And then TLC is total lung capacity, and that's the volume of gas contained in the lungs after a maximum inspiration. So that takes into account all four volumes. That's your residual volume, your expiratory reserve volume, your tidal volume, and your inspiratory reserve volume. Again, these are all normals for a 25-year-old male patient who is approximately 165 pounds and 6 feet tall. Total lung capacity normal, again, is 6,000 milliliters. Vital capacity is 4,800 milliliters, and that takes up about 80% of our total lung capacity. Inspiratory capacity is 3,600 milliliters, which compromises about 60% of our total lung capacity. FRC is 2,400 milliliters, and that comprises about 40% of our total lung capacity. Residual volume comprises about 20% of our total lung capacity. Expiratory reserve volume, 1,200 milliliters, takes up again about 20% of our total lung capacity. Our tidal volume of 500 milliliters is just a small percentage of our total lung capacity, about 8 to 10%. And then inspiratory reserve volume of 3,100 milliliters takes up about half of our total lung capacity. Acceptable deviations for normal from normal or volume and capacities is plus or minus 20%. When we start talking about the different normal values, we're going to talk about percent predicted, and it's much easier to calculate and determine PFTs by doing their percent predicted, which means what percentage did that patient get predicted on what they were supposed to get, and we'll determine how to do that later in the unit. But normal is 80 to 100%, so that's why it can deviate plus or minus 20% from normal. So anywhere from 80% to 100% of normal predicted values is considered normal for our patients. All right, so determining lung volumes and capacities. So if you look at your PFT box again, so either go on page 130 in your math book, or you can use the one that's in your PowerPoint. If you look at that PFT box and you take IRV plus your tidal volume, you'll see that those two boxes compromise or are comparable to inspiratory capacity. So IRV plus tidal volume equals inspiratory capacity. ERV plus residual volume, those two boxes together equals FRC, or functional residual capacity. You can also subtract things. So if you take your FRC and then you subtract off your residual volume, you're left with expiratory reserve volume. Same thing, if you take your inspiratory capacity and subtract your tidal volume, you will be left with your inspiratory reserve volume, or IRV. So if you want to turn to page 131, and we'll do the problems for that one. So the first problem says IRV equals 2,300 milliliters, ERV equals 1,050 milliliters, tidal volume equals 650 milliliters, and residual volume equals 1,300 milliliters. So what you'll want to do is draw out your PFT box and leave it blank. So if you draw that out, then put 2,300 in the IRV box, put tidal volume of 650 in the tidal volume box, place the ERV of 1,050 in the ERV box, and the RV of 1,300 milliliters in the RV box. And then when you're doing these, you want to find your inspiratory capacity, your FRC, your vital capacity, and your total lung capacity. So I'm going to stop there and let you solve for those, and then I will come back on and go through the answers with you in another 15-minute video.